Hello.
Hi, Hannah.
How are you?
Doing well, thank you. How you doing?
Good, good.
I noticed we both have female versions of Hawaiian shirts on, looks like.
We're just hanging on to the last drops of summer.
The last round.
At my house, it's just corn and tomatoes until
Yeah,
there aren't corn
yeah,
and tomatoes anymore.
yeah.
We could start up a separate live where we give a recipe each week.
That would be a good live, and we'd have to have some guests, our little chefs that like to cook in the house.
Yes. Yes. Speaking of which, Maddie Henson, who's the in-house nutritionist at Evocient, was on a couple weeks ago talking about nutrition as it relates to health. And she is doing Maddie Mondays. So if you are a follower on Instagram or Facebook, check out what she's posting on Mondays. It's usually a tip or a frequently asked question or something for inspiration. And I find her so compelling and interesting. So check that out and give us a follow and a like if you aren't already.
Maddie's so great. She's so detail oriented, but it's so easy to follow, and it makes it feel like, oh, I can do that. Yeah. So check it out. I think that's great.
And if you're watching us on Facebook, know that you can also catch us on our YouTube channel, and you can follow us there for any episodes that you might have missed, back episodes talking about other important things. So you can scroll through and see if there's anything you missed that you want to check out. But tonight we are here to talk about BioTe.
BioTe, bioidentical hormone therapy.
So in layman's terms.
Yeah.
Not for me, of course, but, the people.
So, hormone therapy, well, BioTe, I think it's better described as hormone optimization. And so the hormones that they concentrate on are estrogen and testosterone through pellet therapy, and then also optimization of thyroid. Oftentimes when I have patients come in, they always say my hormones are out of whack. And so that gives me the opportunity to have a deeper discussion. We are walking endocrine systems. We are walking hormones from our thyroid to our parathyroid to our estrogen, our testosterone. We have many hormones that are in charge of our body systems and our organ systems and just how we operate, besides just those that I named. And so BioTe is really concentrating on using hormone therapy through pellets to optimize hormone levels.
So when you say pellets, what does that mean?
So the medication and the hormones are actually provided to you in the form of a pellet. And so this, again, is estrogen and testosterone. And so these pellets generally are placed, they are subcutaneous, but generally placed around the buttock area and live there and emit the hormone at a constant level. And so this is a lot different than receiving these same hormones in other forms, whether it's oral or some type of transdermal form like a patch or gel or even vaginal, because we use estrogen in all of those ways, and testosterone can be used as an injection or a gel or cream form, generally for replacement for women.
And so why do you like this method of hormone release?
Well, I like it better, again, because it's consistent and it's more of a stable release, one. And then two, understanding how these pellets are manufactured, I do know that I'm getting the same dosage per pellet, meaning if I decide to give a woman a certain milligram of pellets with this one individual pellet, I know when she comes back for her next pelleting in the next 3 to 4 months, she's going to get that same dosage with another pellet. That there's not going to be a great deal of variance between pellets that I give. Now, when you're using some medications that are prescriptive, specifically generics, just because of how the FDA rules are, those generics don't have to be so stringent with what they have contained in them, meaning that variance is allowed to be a little bit more for them to be called generic or whatever brand. And so you could have plus, or you could have minus that same medication within that generic. But when I use these pellets, I know, hey, this is only really a less than 5%, really 3% variance, as opposed to possibly 50 or even 70% variance.
Whoa, I did not know any of that.
Yeah.
Yeah, so that's add to the common refrain.
Well, that's the big thing when dosing medication and also receiving medication, understanding, hey, how accurate is it that I'm actually getting that milligram or gram or whatever of that medication in what I'm receiving. And so you have what's on the package, but yeah, that bioavailability can be different. And that's actually okay based off of the standards that we have for FDA. And so these pellets are not prescription, meaning you can't go to your pharmacy and pick them up, but they are manufactured, they are compounded by an FDA approved pharmacy that does compounding, and the pharmacy actually receives special accreditation from the FDA based off of how they manufacture their medication. So it's pretty stringent and specific, the dosing and also just the overall production of these pellets.
Mm-hmm. And who falls into the ideal, what types of people are you thinking of that this can really benefit?
Very good question. So the most common group would be those women who are postmenopausal. So who's postmenopausal? A woman who no longer is ovulating. She has reached the age in which her ovaries are no longer functioning at the same level that they were before, and she's no longer ovulating, producing estrogen or testosterone from her ovaries. That's usually around the age of 51. Now, you can have women in their 40s become menopausal, and that's normal. If you are younger than 40, you become menopausal. That's actually what some term early menopause or ovarian dysfunction, ovarian failure. That population of women could also benefit from having hormone therapy, but this is a different population than what I was just talking about. And so the most common, that you would see that needs some type of hormone replacement, hormone optimization with estrogen and testosterone would be postmenopausal women. But premenopausal women, those women who have not yet gone through menopause, actually could benefit also from just some testosterone replacement. Because we have to remember, as we age, and this includes women in their mid to late 20s, as we age, our testosterone levels start to go down. And so what does testosterone do? Well, it helps with our libido. It also helps with our energy, helps with our metabolism, okay? And so helps to keep weight off of us. And so, yes, as we get older, those levels start to diminish. And so you can receive hormone replacement with pellet therapy just for testosterone alone, and if you're a premenopausal woman.
Wow. Why would people designed to have children then lose the energy
to take care of them?
Sorry, that's a tangent, but
so is it painful to receive them? So it is a procedure.
Okay.
Like all procedure, there are minor risk of procedure, but there is a numbing process that occurs before you have the pellets put in. And so it may be that you feel something, but you shouldn't feel pain. You shouldn't be uncomfortable, but you may feel a bit of pressure while the pellets are being put in. For a woman, it's about every 3 to 4 months that she would need to have her pellets replaced. These pellets, again, would depend on, the replacement would depend on her metabolism. So for those women who are runners, those women who are very active, they may be more of the 3 month end, whereas those who are not as active may be able to get 4 months, maybe even 5, but generally it's 3 to 4 months that you would have your pellets replaced. They're extremely small, extremely small. So not something that you're going to see or feel at all. But we do recommend that once you have your pellets placed, you can take a couple of days off from whatever strenuous exercise or increased activity, about 3 days, to just allow the area to heal, to prevent the pellets from kind of coming up below the skin, because again, they're placed subdermally in the fat layer.
Okay. And when the patients are coming in saying my hormones are out of whack, what is that code for? What do they mean?
So for me, that's code for I don't feel good. I don't feel like I used to feel, and there's something up. And so I understand that they may be thinking, hey, it's my estrogen, but yeah, it could be so many other things. Like I talked about, there's so many other hormones that you produce. And so I do check a slew of hormones to make sure we're not missing out on any other deficiencies or abnormalities, especially the thyroid, because the thyroid is responsible for a lot of metabolism. And oftentimes when women are feeling a little bit more tired than usual, they may have a thyroid issue. I do check other vitamins too, because vitamin deficiencies can cause fatigue or just not feeling right. So we check your vitamin D, check your vitamin B12, because these vitamins also impact metabolism and also energy.
Gosh, sometimes when we have these conversations, I think I'm the biggest obstacle to my own care. And I recognize that as a privileged thing to say, but so many times to think like, oh, I'm low energy. And then the person on my other shoulder says, oh, you're low, you're tired. Like, why would you go to the doctor for that? But then of course you would, because maybe there's something that you could do like this that could really change things.
Yeah, maybe there's something that you can do. Again, we talk about I don't want to use the word standard, but the usual forms of hormone replacement therapy being the pill, the patch, some kind of gel, or even a vaginal ring or vaginal cream. And I prescribe those things every day, all day, because they work, but they don't necessarily work optimally for everyone. And they don't always work long term for everyone. And they also may not be the solution for everyone. And then when we talk about testosterone specifically, testosterone dosing for women can be tricky because of the effects of overdosing a woman with testosterone. It can occur very easily, and so you have to be very careful. That's another reason I love the pellets for testosterone optimization, because the risk of overdosing is not the same as if you're using an injectable. The risk of also having those peaks and lows, and not getting a consistent level of hormone is also not the same as with the injectables or with the creams when you're talking about testosterone, with the pills or the patches when you're talking about estrogen, because you get that consistent dosage. And if you know anyone who's had pellet therapy, if you talk to anyone who's had specifically BioTe, the first thing they will tell you is my life is different. And that's a true statement. And it's because, again, they are optimized as far as their hormones go. Hormones are not the only thing to consider when you're talking about fatigue, not feeling well, hot flashes, sweats, fogginess, muscle aches, inability to lose weight. There are many other things that can cause that, but it is something that should be looked into, something that should be considered.
It was such a part of my childhood because my mom would rage at us. She would say this, I'm not talking behind her back. She's welcome to watch. I learned so much from it. Thank you, Mom. But she would rage and say, oh, it's just the hormones, and she would apologize and wish that she wouldn't have been that way and be miserable about it. And that brings me back to the name of your company, Evolving Science. So is evolving science for women. And it makes me sad sometimes to think about these things that exist now that could have made life better for our mothers and grandmothers, but it makes me happy for my daughter and for me.
Exactly, because her GYN care is going to be different than yours and different than your mother's. BioTe, again, is bioavailable. And so this is very different than a lot of the synthetic hormones that are out there. These hormones are identical to the same hormone that you produce, again, bioidentical. And so it's better absorbed. And that's when we talk about that consistency. And if you want to learn more about hormone therapy or many other things that we've talked about on this broadcast, you can go to www.evosient.com/hormone-therapy. It's there down at the bottom to learn specifically more about hormone therapy with BioTe pellets.
And if you know you're on board and want to just go ahead and skip to the point where you make the appointment, there's the phone number, 757-473-2021. Give a call just to consult if it's right for you and to go ahead and get your life better.
Yeah, we are all about optimizing and customizing to each particular woman.
Wonderful. Thank you so much, Dr. Ojo-Cairns.
Thanks, Hannah.
Thanks for watching, you guys. And if you're here with us on Facebook, make sure that you give us a like. Follow us on Instagram. There's different content in that location. And if you want to check any of our back episodes, feel free to check our YouTube channel, Avocient GYN. Thanks, everybody.
Good night, y'all.